Welcome to a Shot in the Arm podcast, and I'm your host, Ben Plumley. This is a podcast about global health and human rights. We explore global health challenges, particularly infectious disease, and how societies adapt and respond to them, whether it's with vaccines, treatments, and prevention technologies, or whether it's good old-fashioned behavior change. This episode is part of a special series brought to you in partnership by the Bay Area Global Health Alliance. The Alliance connects experts and sectors across the Bay Area to catalyze innovation and impacting global health. Its members are world-class academic institutions, technology and biotech companies, and non-profits based in the San Francisco Bay Area and all committed to improving the care for the most vulnerable populations around the world. You can find out more about the Alliance at its website, www.bayareaglobalhealth.org. Well, in this episode, we are going onto the front lines and meeting a doctor based in a city that has mounted, so far it seems, an effective prevention response to COVID-19. We will be joined by Dr Alisson Sombredero, who is the Chief Medical Officer of the San Francisco Community Health Center, a role she has assumed barely 6 months ago. Now, prior to that, she was the director of the HIV division at the Alameda Health System. She obtained her MD from the University of La Sabana in Chía, Colombia, and her voluntary work has included, most recently, board membership of Women Organized to Respond to Life-Threatening Diseases, World, in Oakland, California. Allison, welcome to a Shot in the Arm podcast.
Thank you, Ben. I'm so honored you've been inviting me to this podcast.
Oh,
it's
no.
very exciting.
We're really happy and grateful that you can give us the time in between your extraordinary schedule. Now, as we were setting up, you had to dash off to take a call about a potential COVID-19 test that was needed for one of your patients. What was going on there?
Well, yeah, what's going on is the nature of our job here in the Tenderloin. A patient with mild symptoms who is living in one of the 10 cities. And the patient was already tested by the provider. But the question, what we were communicating about was if we were going to send the test to our private laboratory testing, or we were going to call DPH because possibly this patient needs case tracing if it's positive, and mostly because this patient needs isolation meanwhile the test results are coming back. So this is the nature of our job. Not only decide if the patient needs to get tested or not, but where are we going to isolate the patient waiting for results, and what are the high consequences of this?
We're really happy and grateful that you can give us the time in between your extraordinary schedule. But I wanted to really start with just knowing a bit more about you and learning a bit about your career and your history. So what really brought you into medicine? What made you want to be a doctor?
I think it was the combination of science and service, and the fact that I am a very, very social person and I get all my energy from social interactions. And I think since very early in my life, I knew that what really gives me purpose in life is community and service. So that combination turned out to be extremely good for me and hopefully for the community.
Yeah, it's an interesting balance from, on the one hand, those that, how shall I put this, want to be lab rats and those that want to be out in the community. And you mentioned service, and your career has all been about a duty of service. Why is service important to you?
I think service is what gives us purpose, or at least to me, it gives me purpose in life. And it also puts things in perspective. And with that understanding, every day in your life, you're doing something different. You're connected with different people, and you are making a difference into somebody's life or a big community. So I think it's what we are here in this world is because of service.
Yeah, I completely agree. So you were educated in Colombia, where you got your MD. What brought you to the Bay Area?
It was HIV. It was HIV medicine. When I was in Colombia and I was doing my medical school, I had this experience at one of the government hospitals when there was an HIV ward and the patients were so young and they were dying. And to me, that was very difficult to understand. And I really wanted to put my life in service for these patients. So I knew that places like San Francisco are one of the pioneer places for HIV research and care, in HIV care. And I wanted to be here and be trained in one of the best cities in the world for HIV training.
And you stayed, and here you are at the San Francisco Community Health Center as its chief medical officer. Can you tell us a bit about your role and what your day looks like?
Sure. So it is a combination. It's actually a dream job because it is a combination of patient care. I manage a panel of patients, and I also work in structuring the clinic, in increasing patient volumes, in understanding what does the community need from us and how do we tailor patient care in a way that is compassionate and in a way that is dynamic for the patient population that we have at San Francisco Community Health Center. We are located in the middle of the Tenderloin, so it is definitely a very specific population. And we do have a big number of patients who are impacted by HIV, hepatitis C, also substance abuse, mental disease. And we also have a big, very vibrant community of transgender patients. So it is a combination of how to integrate also all of the programs that we have at San Francisco Community Health Center. This organization has been very well known for 30 plus years for their programs for prevention for positives, for PrEP, for transgender community engagement. So it is, my role is about integrating all of these services in order to make a great center that will give wraparound services, including medical services to our patients.
And so coming on to COVID-19 and its impact on your work, when did you realize that COVID-19 was going to affect your clients and the community that you serve?
Well, I think March 16, when we had the ordinance of the shelter in place, was a very difficult day because just that wording of shelter in place put us all in awe because we thought we do have probably 50% of our patients are experiencing homelessness or are marginally housed. So what does that mean, shelter in place for our patients? So the combination of that with the reality that these patients don't have resources to protect themselves, to have access to hand washing, things that we just take for granted in our daily lives, made us think that this was going to be very impactful for our community. And that because our patients are already very disadvantaged, they do have chronic diseases that have not been well managed. They have comorbidities that are not completely controlled. They were definitely fitting in the category of being at risk for severe COVID disease.
And you mentioned shelter in place, and that's an instruction, I suppose, that we got both from the governor of California, but particularly from the San Francisco County and its Department of Public Health and its, the city's mayor. So really, what does shelter in place mean for clients that are homeless? I mean, just last week there is essentially a city of tents that has built up around the San Francisco Community Health Center's major clinic in the Tenderloin. And these are people who are not wearing masks, who don't have access to basic running water. So just trying to get my head around what shelter in place means for them.
Yeah, well, it is a matter of education in understanding what do they think shelter in place means, right? So what we're trying to do is getting a sense of what does it mean for them. And it is really, they're a community with such a high resilience. And in the middle of all of the problems that they do have day to day, they have been able to adapt so well to all of the difficult circumstances that they actually continue to mingle and being social. And they are definitely socializing around the areas where there's food provided, including our services, because we do provide breakfast every day for our patients. So for them, the definition of shelter in place is very loose, because they are completely in the streets, or they have to go to shelters where there's no possibility for the 6 feet distancing between one bed and another, or one chair and another. And in the 10 cities, there's definitely not much distancing. So I am actually surprised about the fact that there's not been so many outbreaks around the homeless community. And at this point, I am actually not sure if this is because it is a fact that there hasn't been so many outbreaks. There's been few and very serious. But it might be also because we are not testing massively, so we really don't know. And patients might not access care, healthcare places or hospitals for medical attention.
I want to come back to the whole question of testing in just a second, but your client base has had great medical need. These are people that have health challenges like mental illness, HIV. You mentioned there's a large transgendered community that seeks services from the San Francisco Community Health Center, and presumably that includes, getting their hormone treatment regularly. So in this environment of shelter in place, how have you gone about providing the normal care and treatment that they would expect?
So this has been a challenge, but it has been a really incredible and uplifting challenge, because we have been able to connect with the community and making changes on how healthcare is provided in these situations. So for the hormonal therapy, we have increased the frequency. So decrease the frequency from weekly injections to every 2 weeks. So then we don't have patients coming here so often, and we minimize the exposure. We have also offered the patients who were coming here for injections to switch them to oral medications just for the few months that shelter in place is an ordinance. So that's also one of the solutions. Other patients have actually learned how to self-inject, so they can do it from home or their shelter or their tent house. And for other diseases, what we've been doing is we provided 3 months supply to all of our patients living with HIV to make sure that they don't need to come here for labs and asking for refills, but we are making sure that these patients have their antiretrovirals. And also we are providing a COVID RN line. So our registered nurses are calling all our patients proactively, all of the patients who are living with HIV, the patients who have hypertension, diabetes, to screen for COVID symptoms. So not waiting for the patients to call, but we are actually outreaching to them. And because we do have a population that do not have phone telephones, we are actually having 2 outreach teams that are going to where we do know where the patients are. And we are even doing home visits for patients. And not only for medical needs, but also for behavioral health needs. We actually have a therapist who is doing home visits. And of course, we are switching many visits to virtual care, but we do have a subset of the population that doesn't fit in the virtual care model.
And I'm really intrigued by this because, one of the lessons that we say we're learning during COVID-19 is our ability to make use of digital services, of social media so effectively. And could you tell us a bit more about then the outreach teams, the folks that are going out into the tent city, into the communities, into the hotels, I guess, and what sort of precautions and protections are they getting from the center, and what are they offering clients as well?
So we needed to do, of course, a lot of training before getting the outreach teams together, because, of course, the safety of our staff is extremely important for us. So we did training on how to don and doff protective equipment, so how to take it and how to put it on. And we also fitted N95 masks for all of our staff to make sure that they do have a mask that has a tight seal. So they act like a true respirator when they are close to patients. And we did training on how to take vital signs, and we developed protocols to make sure that they ask the right screening questions in order to make decisions if they're going to call us, the providers, or we, the providers, we have to go to where the patients are at. And what the services that they are providing are, first of all, the screening for COVID in terms of the questions, and also asking if actually they do have food security, if they do have a place to stay. And also they're asking if they have any primary care provider, or if they don't, if they need some refills of medications, or if they need any attention, medical attention. And we are also screening patients for urgent issues like abscesses and wound care, because the patients are not going to big hospitals like the San Francisco General because of the fear that they might get infected with COVID in these big settings where there's many patients suffering with the virus. So we are acting right now in a way of urgent care for this community. So the spectrum of what the services that we offer is very broad, and it also includes even behavioral health, because if patients are having an anxiety crisis, or they are having decompensated mental health symptoms, we do have the possibility to deploy our behavioral health providers to take care of the patients.
Wow. And so how are you... Well, I guess this brings us on really to the question of just how the city has responded to COVID-19 and what we're really facing in terms of numbers. But as we get into that question, are the center's teams, the outreach teams, okay? You've not seen any COVID-19 or any concerns you may have with the outreach workers?
So far we have not had any positive COVID-19 staff amongst our San Francisco staff. You know that we do have a Chicago staff, but that's different. So we don't, but definitely protective equipment is very, very important. And we have had multiple times during these past 6 weeks the need to send people back home because they are presenting some symptoms, and they do need to get tested, and they need to isolate until test results are back. And we also have had frontline staff that have needed to be home. They need to be home because they have some symptoms, and symptoms need to be resolved before coming back. But all of us, actually, I was also tested at some point. All of us have been negative so far.
So San Francisco so far seems to have dodged a bullet. It's reported far fewer numbers of COVID infections than perhaps it originally expected. What's going on there, do you think?
So I will give you some data. Numbers are absolutely fascinating. So when the pandemic started, and when the pandemic came to the U.S. and we started seeing the number of cases rising in Santa Clara County, researchers from UCSF and Stanford, they created a mathematical module. And then from this model, they they predicted that with the number of cases that started in the Bay Area and around the area, there were going to be probably 44,000 deaths in the 6 counties. And so far, we have less than 200. So it is absolutely incredible. And we at the beginning thought that this was going to hit us really, really big. Now, in terms of San Francisco, so far for today, we do have 1,233 positive cases and 21 deaths. And, numbers are difficult to understand here because we are not testing massively. So maybe if we look at the death rate, it will be a little bit more understandable in terms of like how good the city is doing. And I think it is a combination of this is a not densely populated city, right? It is a small city and it is not densely populated. And usually the city, you see that is very full of people, but people are not living in the city. It is a transient population. They do live in the East Bay or other places. So I think that maybe that's why there's very small numbers. And another thing is that definitely the shelter-in-place ordinance took place very early. So compared to other, even to other places in California, as the 6 counties of the Bay Area were the first ones to have it. And also compared to the other states, we definitely started early. And also the response of the city and the Department of Public Health has been, I will not say like absolutely astonishing because it's taking time, and mostly for the homeless population. I think that my take on this is that maybe for population that are housed, the response has been really good. But right now, and I'm talking about today, things have definitely changed. And there's definitely the response of the city in the Department of Public Health in terms of getting the hotels for isolation and making sure that testing is a little bit broader and that criteria is not so strict. So I might say that the numbers of the positive patients are a combination of at the beginning of the pandemic here in San Francisco, the criteria for testing was extremely strict, and we were not able to screen a lot of people.
So it does seem that you compare San Francisco to New York or Manhattan in particularly, and of course there you do see a difference between the density of populations, of course. But I guess one of the questions that we've all been faced with is how can we be certain that we're not seeing an epidemic when we haven't been able to test very broadly? And as you said, the testing criteria have been quite strict. That means we've not been testing widely. And so to what extent do you think that is giving us a false sense of security? And, are we essentially going to see a sort of a flattened curve, but a curve nonetheless?
Yes, I think so. I think this is definitely a false sense of security because when you look at data, for example, from the cruises, the Prince Diamond cruise, I think the numbers were around like 700 patients of the whole cruise. They tested positive, and that was 19% of the population of the cruise. And then from those, 46% of these attendants of the cruise were asymptomatic, didn't have symptoms. So when you look at that, then you extrapolate that to a city in a county, and you do know that there's going to be a lot of citizens that are not presenting symptoms, but they are positive. And the biggest thing here is that you are able to transmit the disease even if you don't have any symptoms. So I do think that this is giving us a false sense of security. And if we don't continue our big efforts to stay at home and to isolate, then we might see a spike.
So there's good news, but there's also perseverance that we've got to continue working hard at this. And so I'm wondering what the effects have been on you. I mean, So, you joined the San Francisco Community Health Center barely 6 months ago as its chief medical officer. And I remember being at the launch ceremony for your appointment and hearing you talk about all the important work that needed to be done around HIV, homelessness, mental health. How could you have imagined that something like this would happen in after 6 months?
No, it's surreal, yes. But I think that it is very, very hard for the world and for US and for California, for our relatives, for everybody. But it is an opportunity to change the way we take care of patients. So it has had an impact on me, of course. I think I am super busy, and it's a different kind of busy. It is draining because it is a busy state where you have to be very reactive. Every day there's changes. Every day we have different protocols and guidelines from DPH, and they continue to change. So this capacity of adapt to change so quickly is day by day. It is very, very hard on us as providers and frontline staff, physically and mentally. But I think it is a very good opportunity to understand that change is also good, and that there's going to be a lot of lessons learned from this pandemic in terms of how do we take care of patients and communities.
So what are you learning about how to take care of patients in a community that has mental health issues, that many of the clients are homeless? How do you see changes positively happening as a result of this?
I think in this agency, we're going to increase our street medicine approach. So even though we have had always outreach teams, we have been very centralized in doing medical care and behavioral health care for the patient in our building. But now we understand, because we've seen the impact that street medicine has, that we should also provide big efforts in street medicine, and also integration of care. We always talk about integrative care, but really what is happening right now with the programs, so prevention for positives, the PrEP programs, the transgender community living with HIV, and the clinic with our primary care, all of these programs we have merged, and we are all working for the patients and for the benefit of the community. And this is something that actually didn't happen. We in agencies tend to silo and to take care of only our own pocket of patients. And this is extremely positive, that actually we are integrating care in such a way.
And you were talking about essential frontline staff. You are one of those frontline staff. So you are going into the clinic, every day, requiring to utilize PPE, personal protective equipment every day. How are you managing with that?
It is challenging because we don't have a big supply of PPE. And we've had relief funds federally and from the state, but there's no opportunity to buy. The demand is very is very high, and there's not much possibilities to buy PPE. So we have relied in the Department of Public Health first, but they are also having their own challenges. So really, the PPE that we have had from them is not much. And we have also relied in donations. So actually one is from one of your contacts. So thank you so much, Ben. So we have relied on donation. It's incredible how the world has been collaborating. The whole world has been collaborating with us. And then we've had donations from Asia, from China. So it is incredible how the community has been working together. Now that we do know that everybody in the city needs to be masked, not only health providers and patients when they're coming to to healthcare facilities, but everybody should be masked when going to the supermarket and taking public transportation. Actually, our staff and the relatives of our staff, they're making fabric masks for our patients. So that's how we are trying to do it. It is very scary to actually do all of this testing, knowing that we're not going to have all the PPE that we require. And I think at this point, we are mostly asking for N95s for the respirators. And for some reason, most of our staff is fitted small in the N95s, and they're not available in the US. So those are definitely challenges. Actually, there is some fund that is going to be released to purchase a machine that is going to sanitize N95s. So we are just trying to make the best of it. So if we cannot dispose it, then we might be able to sanitize it.
So this is a conversation, to use the phrase, we should take offline, and how we go about making sure that the center has the protective equipment that it needs. And I think, like many folks in the Bay Area Global Health Alliance team particularly, we have connections and we need to have that conversation. Yes. What keeps you sane? I know that you and I have been on a number of Zoom calls, and both of us have very noisy dogs that decide to make appearances during those Zoom calls. Do your pooches help you stay sane?
Oh, totally. I think even pre-COVID area, my dog is my best therapist. It has always been. So definitely pets are very important, a very important support for all of us human beings, and for us in the front lines, just coming home and having the little tail and ears and all the happiness that they give us and the unconditional love is very, very important. So coping with that, and of course going home and having long walks with the doggy are very important too. I like dancing. I've always liked dancing. So actually, me and my partner, we just put on some music and we dance. We cannot go to places or have parties, but we continue to dance. And the Zoom meetings with the family in Colombia and in other parts of the US are very, very important for connection. Also, meditating is actually something that it definitely keeps me sane. And things like this, like a podcast, is fantastic too, to just get away of their routine and do different things.
So I'm asking all of our guests that come on the show this question. Have you been binge watching any television shows? And if you have, what have you been watching that stands out that we can recommend to our subscribers?
So I am a fan of food television. So I love Chef's Table. To me, that production is absolutely fantastic. So I've been watching them again and again. I just love the productions of Chef's Table. I watched recently Unorthodox, the Netflix series about, I'm not going to spoil it. So it's absolutely fantastic. I think Unorthodox is an incredible series. And I'm guilty of being, to succumb to Tiger King.
Actually, oh no!
I did. Actually, my partner's family, they started to talk about it. And I'm like, okay, I don't think it's the kind of show that I will watch, but I will. And it was a Friday, and I started at 9 p.m. and I turned off the computer at 4 a.m.
Yeah, that was pretty much our experience. Although there was a special additional episode that we've refused to watch on principle. We'll see how long that lasts. But so we have something here which is Masterchef Mornings, And we make sure that we watch an episode of Gordon Ramsay and his Masterchef team every morning. That sort of helps keep us safe.
That's fabulous. I wish I could do that. My mornings are at 7:30 or at 8 a.m. meeting with the San Francisco Community Consortium, the clinic consortium about COVID. So unfortunately, I cannot watch Masterchef at that time.
Gordon Ramsay will be gutted. Well, look, Allison, I don't want to take up any more of your time, the important, crucial work that you're doing. Just a huge thank you to you for all the commitment and all the service that you are giving our communities. Allison, you are a shot in the arm.
Thank you so much, Ben. I think the team at San Francisco Community Health Center has been absolutely incredible. The motivation, the capacity to reinvent themselves and to be innovative and creating different ways to help the community is absolutely inspirational. It is incredible.
Well, keep up the good work.
Thank you.
And thank you so much, Allison.
Thanks, Ben.
Well, that's it for this episode. Thanks again to Alisson Sombredero. Hope you found the show useful and informative. As always, we would love to know your thoughts on the subjects we have covered and the issues you think we ought to address. Please contact us through the usual social networks, including Twitter and Facebook at ShotArm Podcast. Our thanks to our producer and director, Erica Spera of NewsDoc Media, who makes the magic happen. And finally, thanks to you for joining us. Have a great week and a safe week, everyone.